entering Uganda.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome to the DOCtalk Show. My name is Dr. Kamala Ivan, and this show is sponsored by the Ministry of Health and Kamala Men's Collection. So today's episode is about a topic that's literally about giving life, and that is blood donation. So every 2 seconds, someone in the world needs blood. It may be a mother giving birth, it may be a child who has cancer, it may be someone who's just being rushed into surgery, or it may be someone who's just had an accident. So for these people, a stranger's act of giving blood becomes their only lifeline. So welcome to the show. With me here, I have Dr. Henry to discuss this topic of blood donation. So Dr. Henry, we are going to start with the basics. So what is blood? What is blood made of?
Okay. Thank you very much, Dr. Kamara, and good evening, viewers. As rightly introduced, Dr. Ssekyanzi, and it's an honor to be here to discuss about blood donation. So blood is that red fluid that I'm sure you've seen out there. Maybe if you've gotten a cut or an injury, that red fluid that comes out is the blood, okay, in simple man's language. However, this blood is actually made of different components. Some of these are cellular, and the other component is plasma. So the cells that make up blood include what you call red blood cells, and these are the ones which give it that red color that you see. So these red blood cells have a pigment in them. It's called hemoglobin, the one that transports oxygen in the body. So it's this red pigment called hemoglobin that makes blood red, and that's what gives the color of blood red. And so the function of these red blood cells is to transfer oxygen in the body, because our body needs oxygen, all body parts need oxygen for them to be able to metabolize and function. So the other cellular component of blood, we have the white blood cells. Now, these are the cells that help us fight against infections. You realize that at any time too, you could get an infection, things like malaria, you could get a flu, you could get any sort of infection. So the cells that are there to help you fight these infections and also protect you are called white blood cells. Now, these ones have other sub-classifications. We have what you call neutrophils, we have what you call eosinophils, we have what you call B lymphocytes and T lymphocytes. So all these work together to help us fight against infections. Then another important part of blood is another cellular component called platelets. Now these ones are involved in blood clotting. So if you get maybe a cut or you get some minor trauma and you bleed, realize that your body, the bleeding will not continue forever. There comes a time whereby the bleeding stops. Even like when you're brushing under these normal daily activities, someone is brushing and sometimes maybe you could bruise the gums and you bleed a little. So there are some cells in the body called platelets that are going to help form a clot so that bleeding doesn't continue for a long period of time. So these are also part of blood. And so those are mainly the blood components that are cellular. However, there are those others. There's also what you call plasma. So this one has plasma proteins, it has water, and this is what transports most of these other important components in the body, things like hormones. So all these together, they form what you call blood, a very important pigment that our body needs. One, to transport oxygen, to protect us, prevent us from bleeding, and also transport all the materials that are there in the body.
Okay, so blood is like a delivery service. So it's made up of several components that do several functions. So this blood carries oxygen, it carries nutrients, it carries what we call the immune cells. So it carries a lot of things. It carries glucose. You know, it carries so many nutrients to all the different organs of the body. So without blood, you cannot live. Blood is a lifeline, literally. So now we've looked at the different components of blood, the different things that make up blood. So now when we talk about blood donation and blood transfusion, so something that maybe our viewers may not know is blood can be divided into its different components. So we don't always transfuse blood as it is. So we transfuse blood according to what component of blood that you need. So sometimes we can transfuse only platelets, for instance, right? Or we can transfuse only red blood cells, a concentrated amount of red blood cells, what we call packed red blood cells. Or we can transfuse just plasma, depending on what someone needs. So depending on the scenario, you are transfused what you need. And there is a way that blood is broken down into those different components in the blood bank, so as to provide each component separately, and it can be given when and as needed. So those are the different blood products that we have.
Yeah.
Okay. And now also it depends. Also now we have to think about who gets blood and who doesn't get blood. When do you transfuse someone? When does someone need blood? Who needs blood?
Okay, very important question, Dr. Kamala. So it's quite common that at some point we might need to give someone blood, and I'm sure you've heard about it, or you've heard a family member talk about it, that hey, so and so is admitted and they need blood. So there are many situations where patients might need blood. Of course, some of these involve things like blood loss. If you lose blood, for instance, you've been part of a trauma or an accident and you lose too much blood, of course, you need this blood to be replaced so that it can perform these functions that we talked about them. So people who get involved in serious injuries, things like road traffic accidents, and they lose too much blood, they need to be replaced, because if you don't replace that blood, the body is going to lack it. They could get into shock, and they could even have very dire consequences. So things like trauma, somebody has had trauma and they have lost a significant amount of blood, they need to be transfused. But apart from that, and there are things like anemia. I'm sure you must have heard about anemia. It's quite common a term in hospitals, but basically it means that someone doesn't have enough blood. So there are many things which could cause anemia. And usually when patients come to us and they're having anemia and we've made our assessments, we shall decide if somebody requires blood or not. But apart from that, there are also things like childbirth. Our mothers produce children, and we know that this process is quite difficult. Sometimes it involves loss of too much blood. So in such situations, we might need to give blood. So this bleeding sometimes can happen before delivery or after delivery. So we could have things like antepartum hemorrhage as well as postpartum hemorrhage. And whenever someone loses too much blood, it's just logical that you have to replace this blood so that you support the body perform its function. Then there are some other conditions like sickle cell anemia. I already talked about the anemia, but then there are conditions like sickle cell anemia. Our patients sometimes tend to get into crisis, sickle cell crisis, and blood is one of the things they need. So in such situations, such patients will need blood, plus many other conditions. Maybe Dr. Kamala, you could add some if you know.
So there's also cancer patients, another group of patients that really require blood a lot, frequently. So we have different malignancies related to blood. So sometimes you have, when you have a malignancy, what we call cancer of the blood, you may have all your blood components being knocked down, being no longer produced or being destroyed completely. So you have low white blood cell count, you have low red blood cell count, low platelets, all your cells lines are down. And when that happens, like we said, blood is the lifeline of the body. Every organ needs blood, every cell in your body needs blood. So when that happens, your only chance at survival is to get a blood transfusion.
Actually, Dr. Kamala, you mentioned about cancers, things like leukemias. I want our viewers to understand that this blood is manufactured in the bone marrows, okay? Unlike most of these, some of these products which we can manufacture in our factories and using machines, blood is only manufactured in the bone marrow. So if somebody has a cancer, for instance, a leukemia, or those cancers that affect the bone marrow, the factory is going to be affected. And so in such a situation, you're going to realize that the patient will be there and all cell lines are knocked because the factory where they're supposed to come from is no longer functional. And for such a person to be able to live and maybe undergo this chemotherapy that they need to fight this cancer, you have to support them and you transfuse them with blood. So leukemias and most of the cancers, we need to transfuse our patients with blood.
It's now that you mentioned that blood is produced in the bone marrow and it's the only place where blood is produced. So I think I should throw this in at this point, that because the bone marrow is the only place where blood is produced, you know, blood, there is no factory for blood. You can't get blood anywhere else. That's why blood donation is such an important topic. And that's why we are discussing this topic today. And that's why World Blood Donor Day was actually created on the 14th of June, a number of years ago. It was created to raise this awareness of how important it is, how important blood is, how important it is to donate blood, and also as a form of appreciation to all the blood donors out there. Yes, so blood is only made in the bone marrow. There is nowhere else you can get blood. So we literally depend on you, on me. We literally depend on each other for blood. Yes, and also still continuing on the people that may need blood. We talked about pregnancy-related complications, which are very common. And just so that you know, bleeding from the uterus. The uterus is very, very, or we call it vascularized. It has so many blood vessels. It has a very rich blood supply. So if you're to bleed out from your uterus, you can bleed out. You can bleed to death in just in minutes, or just a few hours. Yes, so that's why it's very important. And then we also have trauma, another very quite common thing here, quite common in our leading causes of death in Uganda. We have trauma. And let me just share some, maybe some experiences. So we have, I happen to work with some trauma patients. And let's say, for instance, someone has broken their femur. That is the bone in the thigh. It's actually the longest bone in the body.
Yes,
it's in your thigh. So when you fracture that bone, oftentimes you damage a very large blood vessel quite close by, called the femoral artery. And once that blood vessel starts bleeding, you can bleed to death in just a few hours. So even if that was just the only part of your body injured, you were fully awake, fully conscious, your other organs are okay, your heart is fine, your lungs are fine. Just bleeding from that injury will take your life. So this is how important blood donation is and how important blood is. So when we come back, we'll be talking about, we'll go more into blood donation and blood transfusion, the processes of blood donation and blood transfusion. Thank you for watching and stay with us on the DOCtalk show.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Looking for instant excitement? The Uganda National Lottery Spin for Cash game is now available online. Wherever you are, you can join the excitement for just 500, 1,000 and 2,000 Uganda shillings. Don't miss out. Register now on www.nationallottery.go.ug for a chance to win your share of 2 billion instantly. What are you waiting for? Play Spin for Cash now, anytime, anywhere. Ituba is the proud operator of the Uganda National Lottery.
Uganda National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Good evening, our viewers. I'm Dr. Charles Chiaga, working with the Ministry of Health, the officer in charge of the sickle cell program at the Ministry of Health. The Blood Donors Day is this Saturday. The World Sickle Cell Day is next week, Thursday, on the 19th of June. And interestingly, the theme of this year is blood donation, just because it has been recognized world over that over 30% of blood consumers are people living with sickle cell disease, children suffering from sickle cell disease. And because of that, we found it very pertinent as the sickle cell community to actually add our voice to the drive to boost blood collections. And we all know that blood is a very critical part of our bodies. It's actually the fuel that keeps our bodies moving. And when we are short of blood, it's very critical. By the time somebody needs blood, it's an emergency, because it is within the blood that the gases are exchanged that keep the blood and fuel the metabolic process in our bodies. But it's still within the same blood that our pressures are regulated. So when we lose blood out of accidents, it is an emergency that you need immediate volume so that your pressures don't shut out completely, and your ability to circulate oxygen to the cells continues. Otherwise, you will not be able to survive. And you know, blood is not something that can be manufactured. It's not like a drug. You go into a factory and manufacture it. Blood can never be got from anywhere. Blood can only be donated. If you have not been a blood donor, I challenge you that you donate blood. Sometimes people fear that, you know, when I donate blood, I will not have enough. Actually, before you donate blood, they have to check your blood level. If you don't have enough blood for yourself, no person who actually does blood collection will take blood from you, because you have to meet a certain standard. And you know, when you donate blood, your bone marrow will generate more blood. So it's not like when you give blood, you're going to be at a deficit. No, the blood, your blood production levels will pick up to be able to boost your blood again. In fact, the people who donate are even healthier, because the moment they donate this blood, they give the chance to their bone marrow to actually boost the production of blood. And all of us are candidates that would need blood anytime, because every one of us can get an accident. God forbid, you will need blood, and it might be the real saver. It will be just it might be just minutes between your life and death. If you can't get that unit of blood that you critically need, you may never see life again. And then the mothers who are always in labor need blood. The people who are going in for surgeries need blood. Now we have the sickle cell disease. Sickle cell disease is a genetic disease of the blood. And when somebody has that gene, it impairs the formation of the red blood cells. And actually, people living with sickle cell or sickle cell patients are the biggest consumers of blood. So I encourage all of us to join the bandwagon, to donate blood, and come and join us as we celebrate the World Sickle Cell Day, and also as we celebrate the Blood Donors Day. God bless you. I want to meet you on the World Donors event on Saturday, as well as on the World Sickle Cell Day on Thursday next week. Thank you very much.
You are watching the DOCtalk show.
Hello and welcome back to the DOCtalk show. And today's episode, we are discussing a very important topic, and that is blood donation. So now we are going to dive into the process of blood donation. Yes.
Yes, Dr. Kamara. So, blood donation, like we've seen, it's the process of giving blood. So, I don't know if you've experienced this process yourself, or you've been there, you've attended to patients who are donating blood, or yourself you've donated. What is the experience? What should somebody expect? Maybe if they're going to donate, what is it like?
Yes, so I want to share my experience as a blood donor. So I was motivated by the desire to help because having witnessed so many people losing their lives because there's no blood available. So that's what motivated me to donate blood. So I share this experience not to shine a spotlight on myself, but because I feel grateful that I was able to donate blood and able to be part of this community of blood donors. So I donated blood at a blood donation drive that was happening at Makerere University Business School, Nakawa. So what you need to know is currently most of the blood donation drives we have take place in schools. They take place in secondary schools, in universities, and yeah.
Talk about schools. Actually, I've noticed usually we learn short of blood when as students are in holidays. Okay, and so that really speaks to the fact that most of our donations actually happen in schools.
Yes, and we really want to appreciate anyone that's ever donated blood. We want to appreciate all the students, all the individuals that have donated blood. World Blood Donor Day actually is about you. It's about appreciating you that's donated blood. And you know what's another interesting thing about this is, if you remember during the COVID pandemic, when all the schools were closed for months and months, and I think years, it came to like a year plus. So there was a severe shortage of blood. I do not know whether people were aware of this. Some people were aware of this, some people were not. During the COVID pandemic, there was a severe blood shortage. Why? All because people were not donating blood. Everyone was at home, locked up in their homes. So there was no blood in the blood banks. It was a bad period for us in the hospitals. There was no blood. And I think that's where even our current blood shortage at the moment, we are still recovering from the COVID blood shortage. So now we are still recovering, but people are starting to donate blood. And that's why we are encouraging anyone that can donate blood to donate blood so that our blood reserves, our blood bank reserves are restored. So back to the blood donation story. So I went to donate blood. I was a bit nervous at first, but very hopeful because I knew that this act of giving blood was going to save someone one day. So I got there and there are nurses to guide you through this process. So it's not a terrifying process as you may think. There are people to guide you through it. When you get there, the first thing they do is assess whether you are eligible to donate blood.
So that means there are people who cannot donate much as they might want, but some things could stop them from donating.
Yes. So we have eligibility criteria to donate blood. So you can donate blood if you're 16 years and above, if you're in good health, good health condition, if you've not had a major surgery or a major infection in the last 3 months, and also if your HB levels, hemoglobin levels are okay.
So, Dr. Kamara, how do these healthcare workers know hemoglobin levels? Because in hospitals, we usually run a CBC, which will come with the results of the hemoglobin level. So, in such a situation, such a setting, limited resources, maybe, how do they know that someone's HB is good enough for them to donate blood?
Yes, so if you had done a CBC, that's a complete blood count, where they count all your blood cells. If you had done that and your hemoglobin levels, or we call them HB levels, if they are normal, then you can donate blood. But there's another test that is done. When you go to donate blood, there is another simpler test that they can do to gauge your HB levels, whether they are good enough for you to donate blood or not. So it's called a copper sulfate test. So you will be pricked on the finger, a tiny prick on your finger, and a drop of blood is removed using a small capillary tube. and then that blood is dropped into the copper sulfate solution. And if your blood sinks to the bottom quickly, then it's an indication that your HB levels are within normal ranges. They are within an acceptable range for you to donate blood.
Okay.
Now, if your blood does not sink quickly, that's an indication that your hemoglobin levels may not be at a good point for you to donate blood.
Okay.
So when you go to donate blood, that test is done and you are instantly assessed there and then to see whether you can go ahead and donate or not. So when you find that you are able to donate blood, then you are laid in a comfortable position, of course, laying down, so that you don't faint, so that in case you feel a bit faint or dizzy from the blood donation, you do not actually collapse or faint.
Okay.
So you are laid down, and then the blood is removed through a needle is put through your vein. So a cannula is put in your vein, and the blood is drawn. So they normally will draw an amount that's just enough, depending on your body size, body weight, and just there's an average amount they get from adults. Yes, so it's a safe procedure. It's pretty much painless, just a needle prick. And after you've donated the blood, then you rest for a bit. You're advised to drink something, and that's it. So in the subsequent 2 or 3 days, you may feel a bit of dizziness, but that's temporary and it will go away.
Okay.
Yes. So by the way, our body makes blood all the time. It's constantly producing the components of blood, the blood cells and the plasma. So within, let's say you donate 500 mils of blood, within 3 months, if you're a normal healthy adult, within 3 months, your body will have produced that amount of blood, and you will be back to your normal blood volumes.
Wow.
Yes.
Very interesting experience, Dr. Kamala. So if I may ask, many people are scared of the needle prick, thinking it's very painful, and that actually stops some people from donating. So in your experience, how was the pain? And do you think that pain is that deep and intense to stop somebody from donating?
The procedure is pretty much painless. And I would just want to encourage people to understand and to be encouraged by the fact that this blood you donate is going to save a life. It will literally give a life back to someone. Yes, so that's what I encourage people to do. The procedure is not that painful, and even afterwards, the recovery is not so bad. And a lot of people are eligible to donate blood.
Okay.
Yes.
Awesome. Actually, one was also my experience is that they usually give you something to hold and they tell you to press. I imagine that is to help the muscles push so that the blood flow increases.
Yes.
Yes. And then also mentioned about them lying well in a good position. So you meaning those long chairs that they lie on and they're giving the blood.
Yes, you lie on a reclining bed, actually.
Okay. It's a reclining bed.
Yeah, it's like a bed that reclines, or it's almost like a trolley that can recline.
Okay, awesome, Dr. Kamara. And then maybe my last question to you is that you've talked about this hydration that you do immediately after. I've seen quite a number of people actually being moved by that. They want to go and take that soda. So what's your take on that? So should people just look up to that, or actually they should look at the overall good of saving a life out there?
I think it is better to have foremost in your mind should be the fact that this blood you donate is going to save a life. And I personally, I feel grateful to have been able to donate blood, because this is a story for another day, because later I actually needed blood. I fell ill and I did need blood at some point, and I received blood. Yes, so I have an experience of being both a donor and also a recipient. Yes, so I needed blood, and I was so grateful. In that moment, I thought about all the people that had donated blood that I received to save my life. So that's what I would advise people. Think about the fact that you're part of you're part of a community. By the way, I was just a small part of a larger community, a larger community of blood donors, patients, and life at large. So when you donate blood, you are just being a part of the life-giving cycle.
Wow.
Yes.
And actually,
So,
also one of the
of course,
things I've seen.
that is the drinks.
Yeah.
The drinks after that is good.
Yeah.
The eats after that is good. But more importantly, you are joining a large community of people that are saving lives.
Awesome. Actually, usually they give you that card that you've donated, and if somebody has that card and they need a transfusion someday, I feel like that card is a plus. So if somebody has a card and they have donated it before, even in the minds of health workers, they would want to treat this person as a priority because they know they have at least offered this service and maybe they have helped somebody. So it becomes like easier to help them also get this process done. So I think it's overall a good process. It's a life-saving process. It's charitable, like it ticks all boxes, and I would strongly encourage people to do this over and over.
Yes. So World Blood Donor Day is on the 14th of June, and this day was created to appreciate all the blood donors, appreciate everybody that has ever donated blood to save life, and to encourage you to continue donating blood. If you've never donated blood, to go and donate blood and save a life. Now we are going to take a short break, and we shall be back with a bit more on blood donation.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the rider selection campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes including motorcycles, exclusive HGO gift boxes, and official rider vests, all while promoting safe riding awareness. This is how to participate. Pay the registration fee, invite 3 friends to form a team of 4, and your registration fee will instantly be refunded. Begin your journey of honor today. Don't miss this opportunity. Join the challenge, promote road safety, and become a pioneer rider. For details, visit the official Good Products website at www.hgo.com or call toll free 0800-335-555 or visit our offices at Kingdom Kampala 3rd floor to register now and win prizes worth millions.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back to the DOCtalk show, and today we are talking about a very important topic, and that's blood donation. And right now we are going to dive into blood transfusion. So the process of blood transfusion. Dr. Henry,
Yes.
take us through the process. What happens during a blood transfusion?
Okay. Thank you very much, Dr. Kamala. So after, of course, doctors or health workers have decided that someone needs blood. They have done their grouping and cross-matching. They have confirmed the blood group you're going to need. So a packet is going to be brought. Usually, this blood is kept cold. It's kept cold usually in a fridge. Sometimes there might be a need to warm it up a little bit. And then there's an instrument they use called a giving set where they're going to connect it and then write into your vessel. And then to run for some time. Usually it runs quite slowly. And at that time, you will need to be monitored, okay? Because much as, yes, you can do this cross-grouping and cross-matching, but, you sometimes also need to take an extra caution and monitor you during that period. So you'll be monitored as the transfusion is happening to see if maybe there's anything that happens. So should you start to see anything abnormal, anything unusual, so it's quite important to tell your healthcare workers so that maybe they need to cross-check and see. But usually, it's a very safe procedure. It's a very safe procedure. Sometimes people are wondering if there are any possible side effects or anything which could go wrong. Yeah, sometimes they could be, but very, very, very slight. So especially with the new technologies now these days, blood is really, really screened and checked. They even do what they call induction, whereby they reduce most of the things that you don't need in the blood. So much as the risk could be there in some situations, but usually it's very, very small. So it's a very safe procedure that usually people will go through it. Sometimes there could be some few reactions which could be acute. Sometimes they could come in much later, but it's just quite important that you monitor the patient and see if they develop anything that's unusual, and they can always be able to correct it.
Yes. So immediately after transfusion, or even during transfusion itself, it's not uncommon to get a mild fever or a mild itchiness, mild fever, mild feeling of maybe heaviness in the chest. But this is a normal reaction by your body's immune system, because remember, this blood is it's a foreign substance coming into your body. So some small elements will react, but it's just short-lived most of the time. Very few severe reactions have been recorded with blood transfusion. Most reactions, if any, are very mild and they resolve shortly after. So blood transfusion isn't something to be worried about. It's a life-saving procedure that we do in the hospitals, and lots of people get blood every day. It's quite common, actually. It's more common than people maybe might think. But blood is people get blood transfusions every day in the hospital. Like we've just seen the wide variety of people that would require blood. Yes. And speaking of that, going back to blood groups and blood typing. So blood group O minus.
Yes, very important.
Is a special blood group. Why are we calling it special? Now, blood group O minus is what we call the universal donor. When you have blood group O minus, can donate to all the blood groups.
Be it A, be it B, yes. A, B, be it O itself.
You can donate to anyone. So that's a very special thing about O minus. And then another special thing about O minus is, much as they can donate to any blood group, unfortunately, they can only receive blood from another O minus. And furthermore, by some coincidence, we don't know whether this is evolutionary sequence, but by some coincidence, O minus individuals, the individuals with O minus are not are fewer in number than some of the other blood groups. Yes, so we don't know why this is so exactly, but they are fewer in number. So we always encourage people who are O minus, when we meet you in the hospital, when we meet you out of the hospital, we encourage you to join a community of other O minus individuals. Why? Why must you join this community? So one, O minus blood is precious. It's needed. When it's required by someone, it's going to be hard to get, difficult to get, because of the mere fact that the individuals with O minus are few in number. So it's going to be very hard to get that blood. So we encourage you to come and donate blood. Join the community so that you can donate blood that will help another O minus individual. And when you need blood also as an O minus individual, you will already have that community to get blood from. Yes, so we have the number of they formed actually a WhatsApp group. So we shall share the number of the WhatsApp group admin with you so that you can be added to that community. It's a very, very powerful and useful community. And I would like to appreciate everyone that's a part of that community and everyone that's donated blood in that community.
I mean, like they're doing really great. They're doing a great job. They're saving many people because in an emergency situation, for instance, whereby you may not have all the facilities. I'll give you an example. Assuming maybe you are part of these military people who go fight and defend, and people get wounded. So in a situation like that, assuming somebody has been wounded and you don't have all these necessities and the supplies to do the grouping and cross matching, the immediate blood that you would get, and you're so sure that most likely this one is not going to have any reaction, is that O negative blood group. So it's such a very, very precious blood group. And Dr. Kamala, like you've put it, we encourage people who belong to this blood group join this other community of all negative people, so that you can always help and save people with your blood, because it's very helpful and very resourceful.
Yeah, it's a very interesting, both good and bitter and sweet story, because all minus individuals have donated blood to, they save so many lives. Given the fact that their blood can be received by anyone, they've saved so many lives, and yet they are few in number, and they need to, they search for blood when they need it. So we appreciate the people of all minus who have donated blood. And if you are O minus, we do encourage you to join the community of O minus individuals.
Some people tend to put it that some blood groups are stronger than others. These ones maybe will not get some diseases. And I don't know what Dr. Kamara, your take would be, but I just feel like this is one of the myths that is out there for people to think that, certain people who belong to certain blood groups maybe will be safer from some diseases, maybe their bodies are stronger. I don't know what your take would be on that.
So my take is, yeah, maybe it may or may not be a myth. So we know that there's something called evolutionary advantage, whereby if a characteristic proves to have certain advantages in terms of survival, then that characteristic will be passed on more frequently, and then you end up with a larger number of individuals with that characteristic. So for example, the blood group that has I think the highest number of individuals is blood group AB. So people speculate that maybe the blood group AB had certain advantages when it came to survival, and that's why very many people with AB survived, and that's why they're there now. But all in all, scientific research is not conclusive on the fact that there is one blood group that's superior to another. So as it stands now, we consider all blood groups to have equal survival benefits, equal positive and negative characteristics. Yes, that is the research at the moment. It's not concluded that there's any one blood group that's superior to another blood group.
Awesome. You raise a very important point. And then also another thing that I've seen people usually talk about blood transfusion and donation is that there is a social culture component, social culture and religious component. Are you aware that there's a group of people that actually don't accept this blood donation? So I don't know if you've experienced some of these people before, whereby somebody, even if they actually reach that point where they need blood and it's life-saving, but maybe because of their religion, they will not accept a blood transfusion. Has it come? Have you encountered something like this before?
Yes. Now, blood is a deeply is scientific. It's a scientific topic. It's also an emotional and spiritual issue. People tend to have they take an emotional and spiritual view on it as well, and religious view as well. So we do have certain religious denominations that do not believe, they prefer not to donate blood, the Jehovah's Witness. So we often come across people that decline blood transfusion. And I must say, as a health professional, in our code of ethics, every patient has autonomy to choose to accept or decline medical treatment. So we do respect them. When they decline blood transfusion, we do respect their decision and we don't give them transfusion. However, there is a bit of a gray area when it comes to minors.
Yeah, those are like the children, those who can't decide for themselves.
That's like the children who cannot decide for themselves, who are being decided for by a legal guardian. So of course that we will allow the legal guardian to make a decision for them, because that is the law. But however, sometimes if the child's life is on the line, there is space for us as medical practitioners to step in and rescue this child who is not yet able to make a decision for themselves and may lose their lives because of the decision their guardian is making. But most of the time, things work out. We work between those balances and we come up with a good decision that is best for everyone involved. So we will been discussing some of the cultural and social aspects of blood transfusion, and we're going to take a break and we shall be back for our last segment. Thank you for watching and stay with us at the DOCtalk Show.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Crafted with precision, designed for brilliance, Supreme Wave pens reach the hands that shape tomorrow. Only a Supreme Wave delivers expression this pure. In every stroke, confidence flows. Because greatness isn't guessed, it's written. Supreme Wave, write your future.
Supreme Wave are the best! Mommy, Daddy, Uncle, Auntie, Tata! I am healthy. I have a dosey of the Jab Jab or Drop Drop. Jab Jab or Drop Drop. I wanna live long. Give me the jab. Give me protection. Give me the dose. Health is strong. Give me the jab. Give me protection. Give me the dose. Playing, playing. I am growing, growing. I am healthy. I have a dosey of the Jab Jab or Drop Drop. Jab Jab or Drop Drop.
Parents and caregivers, remember to immunize your children 9 times from birth to 18 months to protect them against vaccine-preventable diseases such as measles, rubella, polio, pneumonia, hepatitis B, tuberculosis, tetanus, meningitis, yellow fever, diarrhea, whooping cough, diphtheria, and malaria. All vaccines used for immunization are safe, effective, and free. This message is from the Ministry of Health with support from UNICEF, WHO, and partners.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome back to the DOCtalk Show. My name is Dr. Kamala Ivan, and today's episode has been about blood transfusion. So this show is sponsored by the Ministry of Health and Kamala Men's Collection. If you have any queries or any comments, you can call the toll-free numbers on the screen, or you can follow us on YouTube and X as well. So we've been talking about blood transfusion, blood donation, and now we are going to wind up with a few questions. So Dr. Henry, now can I just walk into any health facility right now and donate blood?
Okay, that's a very good question. I understand our people have been moved and they are interested in donating, but unfortunately, currently, we don't so much have that liberty that you can just walk into a health facility, because this process requires some bit of expertise. Not everybody will do it. Not everybody will have all the instruments. Not every health facility will have what it takes to keep this blood safe, and also maybe do other relevant screenings. So currently, we have our blood bank, the Uganda Blood Bank. Here in Kampala, we have it at Nakasero, and that's where most of these campaigns for blood donations are conducted. So for Nakasero, you can actually walk in there and donate and walk out. But most of the facilities don't have that as of now. Then there's quite a number of places where people can donate. There are quite a number of drives. Most of the times, I'm sure you've heard about them or you've seen them, whereby you see Uganda Blood Bank vehicles moving around. Sometimes they have speakers with health workers. They'll call on people to go and donate. Sometimes you have health camps where people are going to gather in one place, usually when they are going to receive free medical services. Sometimes it's actually Ministry of Health which has sponsored them. So in most of these health events, we have these blood donation drives happening. So we encourage you to go and vote and donate. Sometimes it's actually on the streets. Okay, sometimes we do campaigns just on the streets, whereby you put our vehicles, put a tent, put our blood donation equipment, and people can walk in there and donate. So there are quite a number of avenues, schools, okay? Like we mentioned earlier on, that most of the biggest contributors of the blood are actually students who are either in high school or in universities. So and quite a number of many campaigns. So whenever you hear of any campaign that's coming forward, and it has blood donation as part of the programs or one of the services that will be delivered, be it a medical camp, be it any health related event, please go in there and donate, because that blood is going to save a life out there.
Yes. So just to reiterate again, so is blood donation safe?
Yes, blood donation is a very, very safe procedure. It's a life-saving procedure. It's a procedure that doesn't have any serious documented side effects. The few possible effects are really, really minor, and they usually don't last that long. So it's a very, very safe procedure. It's more like you would go and take a shot of a vaccine or just go and have an injection. So it's a very, very safe procedure, and we encourage our people to always go and donate whenever they can.
Yes, and just to reiterate the eligibility criteria. So who can donate blood and who cannot? So you can donate blood if you are 16 years and above, if you are in good health condition, you've not had any surgery, any major surgery for within the last 3 months, you've not had any major infection within the last 3 months, you are eligible to donate blood. So if you fall in that category, then you can take the step and go and donate blood. And you can donate blood, as Henry said, you can donate blood at the blood bank, for example, at Nakasero Blood Bank. If you go there and you say you'd like to donate some blood, they will assess your eligibility, and if you are eligible to donate blood, you will donate blood and you join the community of life givers. So blood donation is a safe procedure, and we encourage anyone that can donate blood to go and donate blood and save a life. So I always say that you don't have to be a doctor to save a life. So one donation of blood from an adult person, for example, like me, one donation from me can save 3 lives.
3 lives.
So you can imagine the impact of that.
And like we mentioned earlier on, is that yes, much as sometimes you can give whole blood, this blood can actually be separated into different components. So someone could give us maybe 500 mils of blood, and from that, yes, we can give this all to one person, but also we can separate it and get off packed cells, which we shall give to somebody who needs, for instance, hemoglobin. If the hemoglobin levels are low, we can just give them these packed cells, and that's good enough. Another person will just need platelets. Okay, there are those people who have a low number of platelets, like we said earlier on. That platelets are going to help us prevent bleeding in the body. So somebody could just get platelets from this same pack of blood. Another person could just get fresh plasma, fresh frozen plasma from this part, just 1 unit of blood. So from just 1 unit of blood, you can actually save 3 lives. Quite an interesting fact.
So like we mentioned, right now, blood is in short supply. We have a relative shortage of blood. Like we mentioned, after the COVID pandemic, we went into serious shortage of blood. So now we are recovering our blood supply stores. We encourage anyone that can donate blood to go and donate blood. The procedure is safe, and most people would be eligible to donate blood. And the side effects of donating blood are very mild, and you recover within a few days. So after donating blood, you may get some dizziness, you may get a bit of headache, but that resolves within a few days to 1 week.
I mean, our body has mechanisms of trying to balance up things. So in that, if you lose really, if you donate 500 mils of blood, the body is going to be able to recover this in a very short time possible. So the body has mechanisms of ensuring that, okay, how do we bring back the balance? And sometimes this has a lot of benefits, apart from the fact that it's going to save a life, but it also has benefits onto the body. So it's something that I would encourage people out there to please give a try and do it over and over, because it's life-saving and it's helpful to our people.
Yes. So when it comes to blood donation, sometimes you may be given a card to show that you're a blood donor, and that card may help you in future. There are certain benefits that you get as a blood donor. And the next time you need blood, you may maybe be given priority to get blood. But even that notwithstanding, you can still donate blood to save a life. It's not about maybe the benefits to yourself, but you benefit another person. And so we often see people looking for donations. Sadly, some people get very life-threatening, complicated illnesses that require maybe transplants and all that. And I normally see people donating money to that. But I want to tell you that, yes, that is very important, but an even quicker and good way to save a life without even having a lot of money, is to just go and donate blood. Just go and donate blood. You could save more lives than maybe contributing maybe sums of money to get someone to get some maybe some other procedure done. Yes, just the act of donating blood, you are going to save so many lives.
I mean, because look, with this blood, we don't have a factory for it. Like we earlier mentioned, we don't have a factory for it. So we just have, we as humans, to ensure that, you know, we have enough reserves for ourselves and for people who need it, for the children out there who have a sickle cell, for the mothers who deliver, for the people who get accidents, for people who have cancers, people who have any sort of illnesses that need blood. So it's just incumbent upon us to understand that there's no factory, and it's us to, you know, help each other come out of such disastrous situations of having no blood. So if you can, and the chances avails itself, please go out there and donate that blood.
Yes. So that's our message to you today. As World Blood Donor Day comes up, we would like to encourage you, if you've never donated blood, we encourage you to go and donate blood. If you've donated blood, we are grateful to you. We appreciate greatly. We appreciate all the donors on this World Blood Donation Day. We appreciate everyone that has donated blood, because that blood you've donated has saved a life, whether you know it or not. And I often this one is personal for me, because like I said, I've been on the receiving end of blood, and I kept thinking about all the people that went out and donated that blood. All the I received a number of units of blood, and I thought about all those people and said, these people that went and donated blood are the reason why I am alive today, the reason why so many people are alive today. So do go out and donate blood where you can. So as we conclude the topic, Dr. Henry, what are your parting shots on blood donation and blood transfusion as we celebrate World Blood Donor Day this month?
Okay, thank you very much, Dr. Kamara, and our viewers for keeping it up to this point. I believe you've learned something and you've been inspired to donate blood. So this day of 14th June of our World Donation Day is a day to celebrate people like you who donate and save lives out there. I'll still emphasize that we don't have a factory for blood, but many people need the blood. Where do you get them? That blood from? It's from people like you, generous people like you, who take that extra mile to go donate. So I want to encourage you to always donate whenever you get that chance, so that you can save a life or 2 or 3 lives out there. Thank you very much.
Everyone that has donated blood, we appreciate all the blood donors. And if you've never donated blood, we encourage you to go and donate some blood. Personally, I am grateful to everyone that has ever donated blood. I have been a blood donor, I've been a blood recipient, and blood is the lifeline between all of us. Thank you for watching the DOCtalk show. This show is sponsored by the Ministry of Health and Kamala Men's Collection. If you have any questions, any queries, any comments, don't hesitate to call the toll-free numbers that are on the screen. And you can also follow us on the DOCtalk show YouTube and on X. Thank you for
UBC, inspiring.